Hi there, you're welcome to Dami RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you're able to get alerts anytime we post our other educating and video content on YouTube. All right, so what is our topic for today? Our topic for today is HIV. All right, so what are the things that we need to know about HIV, how it occurs, how to prevent it, and also how to manage HIV in our population as well. So what is HIV? So HIV is a human immunodeficiency virus that affects our body by killing our white blood cells, which are our regular and strong immune cells that the body uses to fight off any infection that gets exposed to the body. These white blood cells are also known as CD4 cells, and without enough CD4 cells, patients can die from infection or cancers or other health problems. So how is HIV passed from one person to another? So HIV can be transmitted from one person to another through sex or through contact with bodily fluids from someone who has HIV or AIDS. There's currently no cure for HIV at the moment, but there are medications and treatments that are available in order to help manage that condition or the infection, in order to help patients live a healthier life and also be able to perform their regular day-to-day normal functions. So what are the symptoms of HIV? So the symptoms of HIV include swollen lymph nodes, which are usually commonly around the lower jaw area. Also, a common symptom is night sweats, as well as rash, fever, muscle aches, chills, mouth ulcers, as well as fatigue. So what are different stages of HIV that exist? So there are 3 different stages of HIV that exist, such as stage 1, stage 2, and stage 3. So stage 1 is usually the early phase, also known as the acute phase, where there's a large amount of HIV in the body and the patient has just been introduced or transmitted, the infection from another person. So usually the patient, like I said, will have a large amount of HIV present in their blood, and patients are usually very contagious at this stage. So patients usually find out that they have HIV through having or developing flu-like symptoms such as fever, headache, chills, body aches, as well as runny nose and low-grade fever. So usually patients will present to the urgent care or the hospital about these symptoms, and they'll run an HIV test and sometimes find out that the patient have HIV. So like I said, that's the stage 1. So the stage 2 is usually the chronic stage, which can also be known as the late/mid stage. And usually patients don't have symptoms at this stage. The infection is still very active, but it's being reproduced at a very lower level in the body. And this stage may progress for about 10 years or more in the body, depending on how the patient is taking care of themselves. The transmission is still possible in this stage, and towards the end of this stage is usually when the viral load, which is the amount of virus that's in the body, and increases, and the CD4, which is the white blood cells that help fight against this virus, reduces because it's taking over the immune system. And symptoms may start to show towards the end of this stage. So what is stage 3? So stage 3 is known as the last phase of this infection, which is the AIDS stage, whereby the HIV has progressed into AIDS, which is known as acquired immunodeficiency syndrome. So usually at this stage, the immune system is very weak and suppressed due to the amount of viral load, as I said earlier, that's accumulated in the body over time. So patients have to take medications other than their antiretroviral therapy to help prevent certain infections, because at this stage, the patient might get a slight infection and it might be very detrimental to their health. So usually at this stage, the patient's CD4 counts, which is also known as the white blood cells count that we were talking about earlier, or the immune cell count, is less than 200 cells per milliliter. So this is a very low amount of number, and like I said, patients will have to take other infection preventative measures or medication in order to help them from having another infection added onto the AIDS they already have, which can be very detrimental or can lead to death. So without treatment at this stage, usually the average lifespan when HIV has progressed to AIDS is about 3 years. So how can you prevent HIV in our population? So number one method is to use protective methods during sex, such as using condoms and other protective measures that are accommodating to you in order to help prevent yourself from this virus. Also, there's something called the pre-exposure prevention, which is when patients are at an increased risk of getting HIV, so they start taking antiretroviral therapy in order to help just in case they do come in contact with patients that have HIV sexually or come in contact with their body fluids, which can lead to the infection. Also, another therapy that patients can be on is known as the post-exposure prevention, which when patients immediately find out that they have been in contact sexually or being in contact in terms of bodily fluids with a patient with HIV, they would take an antiretroviral therapy for a couple of months in order to help decrease that viral load, and they have seen major improvement in terms of patients not having the virus because of that immediate therapy that they've started after being in contact. Another preventative tip is to avoid sharing needles or sharp objects with other people, and also avoiding multiple sexual partners. Also choosing less riskier behaviors, such as for example, oral sex is less riskier than anal or vaginal sex when it comes to HIV. And also anal sex is known as the highest risk of patient being transmitted HIV. Also, another thing you can do to prevent yourself is making sure you're getting tested pretty often, or making sure you're going with your partner as well to get tested often. Also, you want to encourage your partner, if they do have HIV, to continue taking their medication in order to help reduce their viral load and kind of reduce your risk of having the infection. So how can you manage HIV? First thing you want to do to manage HIV is find a healthcare professional that specializes in infectious disease or HIV to help in terms of taking care of your medical needs. So another thing that you want to do is making sure that you're taking your antiretroviral therapy as prescribed, making sure that you're not missing too many doses, and making sure, like I said, that you're being compliant with how much you're supposed to take per day. Also, you want to make sure that you're attending your doctor's appointment regularly for blood work in order for them to monitor the improvement of the infection, as well as for you to be able to discuss your health concerns with your doctor regarding what symptoms or what signs that you're feeling when it comes to the infection progression. Also, you want to make sure that you're keeping your appointment regularly in order for them to be able to keep track of the treatment plan that they're placing you on. There are many medications that come out during the year that could be much better than the medication that the patient is already on, that they can easily switch you to because of the more effectiveness or more effective studies on that new medication. All right. So what is another thing you can do? Another thing you can do to manage HIV is by joining support groups. It's very important to have a community of people that share the same interests as you, and also being able to share your concerns with them, and also being able to talk through it. It just helps patients in terms of emotional needs, medically, they could be, they could help you in terms of letting you know what therapies that they're on, and what kind of side effect that they're facing which can also be something that might be beneficial to you later on down the line. Also, making sure that you're engaging in physical activity and exercise, or employing healthy lifestyles such as eating a balanced diet as well. Also, making sure that you're avoiding smoking. Smoking in HIV patients can actually increase their risk of having cancer in their head or neck region or the lungs. Also, it can increase your risk of having pneumonia, so we don't recommend smoking. If you are having issues with quitting, you can dial 1-800-QUIT-NOW, and there's a personnel available to help you in terms of your quitting process. Also, another thing you want to do is making sure that you're informing your sexual partners about your positive status. That way, they can also be able to maintain their health while they're with you. All right, I hope I was able to help with this couple of tips regarding what to look out for while treating HIV, and also what are the symptoms and how to manage them. Thank you for staying tuned to our channel. Make sure if you haven't yet, hit the like and subscribe button down below. That way you can be a part of our community here at DamiRx Care. And also you can get alerts anytime we post our other educating videos and content on YouTube. Thank you for watching and stay tuned.